If we're in need of a crisis to make us focus, we've got one.
As the Mississippi Senate Committee on Public Health and Welfare gaveled to order, Greenwood-Leflore Hospital was front and center on the agenda.
Hearing that Greenwood was having severe difficulties, I thought that was a crisis situation. And so I began to see what the lay of the land was. And the response was, well, it's not merely Greenwood. That's just the first one. But hospitals across the state are in a terrible bind.
That was just the beginning. The news got worse from there.
It's estimated that 38 of our hospitals, of our rural hospitals statewide, are in danger of either immediate closure or closure in the near term.
38 hospitals. That's 54% of all acute care hospitals in Mississippi. Much of the failures owed to the economics of health care, where in the Delta, we rely on public assistance more than any other region.
For Greenwood, the Medicare and Medicaid reliance is significant. It's almost 75 to 80% of their book of business, and that's going to pay you right at or right below your cost. That makes it really hard when you're trying to get the revenue.
And the news gets worse again, setting up what some call a no-win situation.
But when we look into access of care issues for the Mississippi Delta, then it really doesn't matter what your insurance status is. You can have the best Blue Cross plan in Myersville, Mississippi, and you're going to have difficulty with access to care. And unfortunately, that is getting worse instead of better.
So many of us apparently flee to Jackson or Memphis, leaving hospital beds here empty.
When I saw low volume in census at Greenwood-Leflore, then I started looking around the Delta at census numbers. It was alarming to me at that point that something was going on in the Delta specifically.
But no one could come up with a solution except for one quintessentially Delta prescription for a Delta problem. Senators say Parchman holds many inmates eligible for release, but it can't release them because they're not eligible for Medicaid. They propose a nursing home for those inmates, and guess where?
So far as I know, no one ever considered the notion of trying to locate that nursing home at Greenwood and having the Greenwood Hospital own it.
And there are many who say tonight, whatever UMMC was offering looked a whole lot better. Dennis Turner, the Delta News.